Hello, and welcome to Crucial Conversations with the Nashville Chapter of the National Association of Black Journalists. I'm Sandra Long Weaver. I am a founding member of the National Association of Black Journalists, and today our guest is Dr. Alicia Hall. She's a board-certified family medicine physician, and she is a graduate of Meharry Medical College. So welcome, Dr. Hall. Thank you for being with us.
Thank you, Sandra. Glad to be here. Thank you.
Yes. And Dr. Hall has been involved in some of the testing for COVID-19 in the Nashville area. And so we wanted to talk today a little bit about what you've been doing. She's in private practice, but was one of the physicians contacted to help out with the testing, especially of senior African Americans. So can you tell me a little bit more about how you got involved? I understand the Black Caucus of the Metro Council and the Housing Authority.
Yes. So there were some elected officials in Nashville who wanted to make sure that the senior community, and especially African American senior community, was being addressed to make sure they had access to some of the COVID-19 screening and education, and as well as the testing. And we particularly wanted to target the low-income areas. So we went to the affordable housing community with MDHA, the Metropolitan Development Housing Agency. And we partnered with them and some other community partners like Metro General Hospital to bring screening and testing for COVID-19 into those communities. And so we started this project and initiative back in the spring of this year, right when the pandemic had just hit. Mm-hmm. And we went to
in mid-March,
around mid-March into April. Mm-hmm. And April was when we actually started initially, and they reached out to smaller community practices like myself, just to make sure that we could get the initiative started. There was actually a national back order of PPE. There was a shortage of supplies. If everyone can recall, around the nation for getting PPE, like masks and gloves and isolation gowns and the required medical supplies needed to do the COVID-19 testing. But with my practice, we were able to at least start the initiative with the supplies that we had. And it was just an honor to actually go into the community, go to certain housing developments where primarily senior African Americans lived, to do actual screening and testing for COVID-19. And a lot of the seniors, they had limited access to transportation, limited access to even get to the free COVID-19 testing sites. You know, a lot of them were isolated from their families and loved ones just for the sake of safety. So to have health professionals come on site into their community for them to talk with directly meant a lot to them. So.
Oh, so you were able to actually go into the areas where they live, and they're able to and test. And so what were you finding? Was there a high rate? We keep hearing that African Americans are affected disproportionately by COVID-19 and unfortunately die at higher rates. Yes. What were you finding when you were going in?
So in the particular communities where I went, I was really pleasantly surprised to see that a lot of the seniors were adhering to the CDC guidelines for prevention and spread of COVID-19. A lot of them were quarantining themselves at home. If they were out, they were social distancing. A lot of them were wearing masks. You know, a lot of them limited contact with others and limited who would come into their homes. We did have one gentleman, unfortunately, who he was elderly, and he was going for dialysis, and he had some mild symptoms. And so that was one person that we were able to intervene and do testing on site with him. He had COVID, and instead of going to the dialysis center, he went to a hospital and notified them that he had it, and went to a hospital to an isolated area. And so we helped to prevent spread. That a case like that shows you can help prevent spread to others, especially in healthcare facility settings like a dialysis center.
Right.
So yeah, they were very encouraged with our presence there, and were appreciative that someone had reached out, considering that a lot of them really weren't able to see family and friends to come and check on them. So we were able to go and check on them.
So now, will you go back? I mean, there's the level of testing has come up again in the news that we're not doing enough testing now. That, you know, doing the test, trying to get, we got the numbers up in the very beginning, but now it seems to have dropped off a little. So do they need to be tested again? Or
Yes.
stand?
You know, that's a good point. You know, a lot of persons may have gotten tested in the early spring, but this pandemic still exists. So I say, and I've said to them, you know, anyone who's even been to a grocery store or anywhere in a public place, that periodically it is good to get tested, you know, even if you don't have symptoms, you know, just so that you know your status. And so if you've been around anyone out in public, even if you've been, you know, wearing your mask and doing the social distancing, I think that everyone should, if you should get tested just so that they know. I, as a healthcare professional, am in a higher risk category, so I actually get tested.
Oh,
Just
really?
because, yes, because I've been
every week or every other day. How often are you getting tested?
I would say, for me, it's been about every 3 months. And I could go every month, but I definitely monitor for symptoms, just to make sure, you know, I monitor my temperature. And that's what a lot of folks do, monitor their temperature. And for other symptoms like shortness of breath, cough, you know, thankfully I haven't had that.
Right.
You know, and so, but yeah, I think it's good for everyone to know, just because if you've been anywhere around other people, it would be good to know. It's not that common, but you do have people that carry the virus and don't have symptoms.
Right.
So as we've seen with some of the younger persons.
Yes, it's young people going back into bars, and schools are about to open now. Should grandparents be still worried about their grandchildren possibly passing the virus on to them? Should they still be self-quarantining at this point?
I think that they should. And according to CDC guidelines, yes, it's recommended that people limit contact with others and even coming into the home. Children tend to have, or younger persons tend to have stronger immune systems. So if they've been exposed to the COVID-19 virus or anything else, they have a pretty strong immune system to fight it off. Persons that are over the age of 65, you know, they're a little bit more susceptible and vulnerable to becoming infected with COVID-19 if they should get exposed to it. So, you know, no one wants to be away from their loved ones, especially grandkids.
It is different.
Yes, and you know, that's the heart of the family for grandparents and other relatives. And so that's a difficult one, but it is something, you know, in order to be safe, you want to practice safety, you want to practice those type of precautions. And you know, it'd be different if children were isolated from other kids and the public, but if they're around all these other children and people, then they're at risk, unfortunately, for being exposed to the virus and possibly carrying it.
So, couple of things. So they're working on a vaccine, and should African Americans be first in line to get this vaccine? I know there is a hesitancy given the history of how African Americans were treated in the past, experiments with health issues. So there's a reluctance, I know, in the African American community about being first to get this vaccine. Where do you kind of fall in there? Nothing is released yet, and we can't say when people may be vaccinated.
Right.
But where?
Well, yes. Well, even outside of a pandemic, when a vaccine is developed, it typically takes on average, maybe, the earliest might be 2 or 3 years to get a vaccine developed, but maybe 3 or 4 years is kind of a more realistic time frame, because that vaccine does have to be tested. Their trials have to be run, because they, before the FDA can put an approval on anything, they have to have a lot of testing and make sure all the side effects and any adverse reactions are all recorded. And so, we're talking less than a year, maybe 6 months to develop a vaccine. I would not be the first one to sign up to get that vaccine.
Right.
But I'm all for, progression in the scientific community and development of a vaccine for COVID-19, development of medicines that can treat it. And, I'm thankful to know that, we have institutions like Meharry Medical College that are partnered with, I believe, NIH, or, partnered with other government organizations to help develop some treatment strategy or treatments for COVID-19. And so I'm all for that. But as far as when it comes to a vaccine, usually it takes longer to develop it, longer to even to weigh out the safety factors of a vaccine, so to test it out. And so it would be a little premature. I know we're in a pandemic, but I'd rather, practice safety myself and not be the first one to sign up for something that still may be an experiment.
Right. That's sort of the feeling that's out there. So that's good to hear. But okay, so what about getting a flu shot? We're now in the month of August, and I know that's generally when flu shots start to become available for the older population, the pneumonia shots. So should we still get those, or just worry about COVID testing?
Absolutely. Everyone, the CDC recommends everyone from infancy, I believe age 6 months, up to 99. Everyone should get an influenza vaccine once a year. And getting the flu shot is very protective, especially if a person does have other chronic health conditions, such as diabetes, blood pressure, lung disease, if they're elderly. But even if they're young, it's protective. And considering we're in the middle of a pandemic and we're dealing with a respiratory virus, and then, we have, unfortunately, flu season, the influenza virus that predominates more in the late fall to winter to early spring, that when that season comes up, and also the cold and flu, the other cold viruses also predominate, it would be wise for everyone to get a vaccine for their protection, as recommended by the CDC.
So what about travel? Airline travel, train travel, is any of that considered safe at this point, or should we all just really take it case by case?
It's still a risk to go anywhere. It's a risk to go to the grocery store, to be honest. But you have to eat in order to live.
Yes.
And I definitely miss going on vacations and being in nice scenic areas. But with the travel, proper precautions are adhered to by the airline industry, and it is a risk to get on an airplane with others that is a closed environment, and the air is circulated. Mm-hmm. And so, even though they advise you to wear a mask on a plane and in the airports, and they hopefully most airlines are practicing social distancing and having customers to sit 6 feet or more away from each other. Some airlines may be practicing that more than other. If persons are being in close proximity to each other, packed like a sardine, like some would say, on an airplane, I would not trust going on that flight, but so it's a risk still to travel. But another thing that we're seeing, there are not as many people traveling. So a lot of the planes are not as filled. They're more vacant. And so, that may make it a little safer in that sense, that you're not as exposed. You're not around as many people on these flights. So if you travel by plane, I think traveling by car is the safest if you're going to travel somewhere, if it's a drivable distance. So
right.
Yeah.
But if staying overnight in a hotel, that's still something to consider, and how they are cleaning and making sure.
Yes.
So there's
still
a lot of issues.
There are, and people may take their own cleaning supplies. We don't know how well a place is being cleaned and disinfected. Hopefully, you can always ask the hotel management or, the management of a facility that you plan to visit to see what their cleaning policies are. And, hopefully they have some type of policy in place and are practicing what the local public health department authorities are advising them to do as far as disinfection and cleaning. But it's good to kind of have your own supplies, I would say.
Yes, it sounds like it. And you are also the president of the Tennessee Women in Medicine.
Yes.
So how is that organization, and how large is it? So this is the entire state, women who are in medicine who are involved.
Yes. We're comprised of over 300 members, and it is a statewide organization, and we're open to medical doctors as well as clinical psychologists and dentists as well. And we're most of the members are located in the Nashville area, but it is statewide. And so, yes, I'm thankful for that organization. We like to do educational seminars just to increase our awareness of different health topics going on. And it's also great as a networking organization for support in our field and profession. And, during the pandemic, we've had some seminars on COVID-19, as well as kind of doing things the new way that everybody else is doing, using Zoom and virtual platforms to host our meetings. So
it's been, I think we've all had to learn new skills and communicate with each other in a different way. And in some cases, it's the only way that we're communicating with people, if we're isolating ourselves at home. And Dr. Hall, I appreciate you being with us this afternoon, but I wanted to ask you one more thing. And that's sort of, what do you see, what's next in terms of this pandemic? What should we be thinking about or doing at this point?
Yes. Well, as a family physician, I'm always emphasizing the basics. We're about to head into fall and winter, the cooler months, what's typically, as we said earlier, kind of flu season, cold season, and then we're dealing with this pandemic. So just exercising really good health habits, such as eating whole food nutrition, fruits and vegetables. I'm a big believer in the adage, an apple a day keeps the doctor away. So, you know,
Okay.
eat those healthy foods that are going to boost the immune system, your fruits and vegetables, get plenty of rest. You know, get at least the optimal 7 to 8 hours of sleep at night. Keep yourself well hydrated. You know, consider the vitamin supplements even and foods that boost your immune system. You know, I'm a big believer in vitamin C, and, you know, there's elderberry, there's other supplements that boost your immune system, but you just want to keep your stress levels as low as possible. I know we're in a pandemic, things are so changed, but staying connected, you know, staying informed, staying educated, those things help with our mental well-being or social well-being, and then for our physical, you know, exercise. Even though some may be leery to go to a gym, you know, there's still parks, you can still walk and exercise. So I'm preaching to myself on that one, but but you definitely want to just have some good self-care, and you know, stay informed. You know, it's still so new to us all. You know, be aware that you just have to practice some good judgment and common sense. Continue to social distance. Continue to wear your mask when you're out in public, and encourage others to do so. That you know, within your circle and community to do the same. Wash your hands, and, you know, practice those good hygiene practices there. And so, you know, I pray that it doesn't get any worse than what it is right now. I'm hoping that we're kind of peak, because this is a global pandemic. We have not seen this in our lifetime, I would say. And I think that, you know, with science and technology, you know, there's no limit as far as finding a solution, as far as a vaccine, as far as some medication to treat this. And then, you know, just everybody taking ownership and doing all that they know to do, practicing good judgment to minimize and prevent worst case scenarios, and to have better outcomes, you know, for the months ahead.
Right. Okay.
Yeah.
Well, thank you, Dr. Hall, for being with us today. Thank you for your tips and making us aware of what is going on, and providing care also especially to senior African Americans. And thank you for joining us, and continue to tune in to episodes of Crucial Conversations with the Nashville chapter of the National Association of Black Journalists. Again, I'm Sandra Long Weaver. Have a good day.